Back pain is one of the commonest health problems that is responsible for most of the sick leaves in the modern society. To start with, preventative measures of getting back pain is much more important and effective than treatments. And preventative measures by obtaining a good posture, being healthy, eat healthy, doing simple but regular exercises, avoid certain movements and certain ways of lifting heavy weights. All those contributes to a healthier spine. And the healthier the spine, the less the potential to develop chronic back pain. However, there are some genetic predisposition factors, some occupational factors, some body habitus issues that would predispose some patients, despite whatever they do to try and prevent the back pain problem, into having back pain problems. Now, back pain can vary from being a simple muscular pain issue to a sign of an intractable and serious spinal condition that needs urgent medical attention. And therefore, having a back pain that is not going away after the usual few days of bed rest and analgesia and painkillers, that needs to be looked at by a specialist in order to verify whether it's just a simple muscular spasm phenomenon or whether there's something an underlying disease or problem that needs to be addressed. Back pain can vary from the source, according to the source of the pain, from one, the simple muscular origin of the pain, which could be due to muscle strain, muscle spasm, some tear in the muscles due to an abnormal posture, an abnormal movement, a heavy lifting. And that is the easiest origin or the easiest source of pain. And normally that requires an amount of bed rest, a good pain controlling medication, and some physiotherapy input to rectify it. And that is an unlikely source of a chronic back pain issue. We all get these back pains day in, day out, but they don't persist and they go away without much of an attention. The second source of back pain would be the joints. There are small joints in the lower back where our vertebrae articulate with each other and our spine articulate with the hip, for example. And those small joints can be source of pain when arthritis develops into those joints and injury or inflammation into those joints. That is the second source of pain. It's less common than the muscular pain, but it is a common form of back pain problem. We call it the mechanical back pain coming from facet joint or facet arthropathy. And that would be the second type or cause of back pain. The third one is the one related to the nerves. The nerves, within the vertebral column lies the spinal cord, which is the big cable that conveys the electrical messages from and to the brain. And it connects the brain to the organs, the upper limb, the lower limb. And in the lower back, there is nerve roots. There are a bunch of nerve roots that contributes to the nerve plexuses that supplies sensation and motor function to the lower limb and the back. Those nerves can be affected by compression and irritation and inflammation, and all those things can give rise to what we call neuropathic pain. And this neuropathic pain can come from problem within the nerve itself or problem from a compressing structure onto the nerve, which could be the joint, could be the discs. And the commonest form of these neuropathic pains in the back is well known to people as sciatica, where protruded disc or a disc that goes out of its position start compressing onto the roots of the nervous plexus that goes to the lower limb and produce this acute, severe, sharp back pain that shoots down the leg and shoots down the lower limb. And this is the third type or the third source of back pain. Back pain can be coming from other places. It's a radiation, it's a referred pain where people get problems elsewhere that it reflects itself in the back. For example, it can come from visceral issue. The kidney can give you back pain. The aorta problem with the big blood vessels can give you back pain. Even the heart and heart problems can present itself as a referred pain into the upper back. Pain at night. Now, the day and night variation of pain can gives us an indication of what is the source of that pain. For example, muscular pain is continuous, related to posture, related to activities. A pain that gets starts worse when you wake up and then improves indicates that the pain is coming from the joints. But the pain that gets worse at night is more related to the nerve origin, neuropathic pain, as neuropathic pains gets worse at night. And that can indicate it is related to the spinal cord and the nerves associated with the spinal cords. And that may give rise to serious conditions if not looked at and treated. Therefore, it would make it more essential to investigate in such a situation or scenario. Back pain is a complex clinical situation that requires multidisciplinary input. Now, as I mentioned earlier, the simple back pain that is muscular that we all suffered from at some point in our lives, it just needs some rest and some analgesia, painkillers, and it goes away within few days. The more serious pain problem associated, back pain problem associated with the joint issues or the nerve issues needs a multidisciplinary input, needs input from pain physicians, spinal surgeon, physiotherapy, and even pain psychologist. There could be a role for the alternative medical options like acupuncture, chiropractor, osteopathy. All those together can formulate a plan if working together in a multidisciplinary team setup to address the problem the best possible way.